Hey kids, so we've talked about taking vital signs for your patients in the classroom, so now it's time for us to demonstrate how to actually take vital signs with our automatic vital sign machine. Now there's only one vital sign that this machine will not measure, and that's respiration. So when we get to that point, I'll teach you the tricks of the trade on how to get your respirations assessed. But so first off, we're just going to gather all of our equipment, which is the vital sign machine. I'm going to come over, use some hand gel. Still got my gloves in my pocket in case I need them. This patient's not on any kind of precautions, so I'm not going to put those on just yet. Knock, knock. Come in. And remember, you're always going to include your pre- and post-procedure guidelines regardless of the procedure. So, hey, Miss Langston, how are you?
I'm good. How are you?
I'm good. Well, my name's Lynn. I'm from Hartsville High School. I'm just going to get your vital signs right quick, your pulse and blood pressure and stuff. Okay. Go ahead and get some more hand gel. All right. So, can you tell me your name and birthday?
Jan Langston, 2/22/71.
Awesome. All right. So I'm going to go ahead and raise this bed up just a little bit so I don't have to lean over the whole time I'm in here. So I'm going to raise it up to a comfortable working height for me. Lower the side rail. Okay, so this is our vital sign machine. It's got a power button. Looks like every other power button you've ever seen. This is how you're going to turn your machine on. It's going to go through a little systems check. It's going to light up. And then when it gets to this screen, you know you're good to go. So let's talk about what's on this screen. This first one, you have your systolic pressure. That's your diastolic pressure. So these first two are your blood pressure. This SpO2, that's your oxygen saturation level. And the little heartbeat here, that's going to give you their pulse. So really the only thing that you're going to have to manually assess when you do this is respirations for your patient. Now, you'll notice on your skill sheet, it's numbered 1 through whatever. What I've found is that you will get into your own routine as to what you do first, second, and third. Whatever helps you to do it the quickest. Because let's say you've got 10 patients on that hallway and you've got to do all 10 patients a complete set of vital signs. So you're going to start getting your own routine down. So when you check off, as long as you do everything appropriately, you'll get credit. It doesn't have to necessarily go in that order, okay? So first thing I like to do is put on my blood pressure cuff. Now this is just like the regular old blood pressure cuff that we've talked about. You can see it's got an artery marker right here. You're going to put that over the brachial artery. So come around here. You know it's to the inner aspect of the middle of the arm. So you're going to go at least 2 inches above the bend of the elbow. I like to just take it all the way up to the axillary area because it might fall, you know, sometimes it kind of falls down. All right, once you get it on, put 2 fingers underneath to make sure it's not too snug. And just ask the patient to relax their, just relax. It's not going to hurt. Just going to give your little arm a hug. Okay, so here's the button that you press. Look, it's a no-brainer. It's an arm with a blood pressure cuff on it. So you just push that. The cuff will inflate and it will start taking the blood pressure. So in the meantime, while that's working, I'm going to take the temperature. So you remove the probe from the holder, get you a probe cover, ask the patient to open up, and you're going to put it in a sublingual pocket to the side. And you can hold it for the patient or they can hold it for you. It's going to go around and around, 98.6. And look, you can tell these patients what their vital signs are. They belong to them, so it's not a secret. You can tell them, your temp's 98.6. Now, what if they ask you, is that normal? Well, by the time you go to the hospital, you should be well versed in what's normal or not. But you don't want to like alarm the patient. So you tell them the value, and let's say it was 102 or whatever. You say, well, your temp's a little high, so I'm going to go tell your nurse. Same thing with the blood pressure. You don't know what's normal for that patient. You know, we know normal blood pressure is less than 120/80, but their normal might be 130/84 or something like that. So don't try to explain any of the vital signs to your patients because that can get you in trouble. If they have questions, always go get the nurse. Let them know, hey, that patient's got some questions about their numbers. So just don't want you to get in trouble that way. All right, so the temp's taken. We've got our blood pressure here. You can see it's 121/75. And right here we've got our pulse. Okay, here's the trick. So while the patient's having their blood pressure assessed, or at some point in this, and like I've done this now, my blood pressure's already taken, the patient doesn't know that this machine's taking their pulse. So generally what I do is say, okay, let me get your pulse. I'm going to hold their hand right here, and I'm going to fold it over their midsection. And I'm going to look at the clock, and I'm actually going to count respirations. I'm not counting a pulse. My machine has done that for me. So now I'm going to count respirations for 30 seconds. Patient doesn't know that. Now what do you do if the patient starts talking to you? They really like seeing y'all at the hospital, you know, you young people and whatnot, or at the outlying sites. They'll start talking to you about, well, what are you doing here? Why are you not in school? And tell me about your program and stuff like that. You don't ever want to be rude and say, can you please be quiet? I'm trying to, you know, you don't want to do that. What I generally will do is while they're talking, I'll try my best, and you cannot accurately assess respirations while the patient's talking. So usually what I'll do is just hold up my finger like 1 minute, like I'm trying to concentrate, and usually they'll get the hint that they need to be quiet, okay? So you're gonna count the rise and fall, that's 1 respiration, okay? And we'll go over this in more detail when we do the manual pulse and respirations, because that's gonna be your actual validation. When you do your validations for automatic vital sign machine, I simply want you to know that at some point in this process, you have got to check respirations, because it's not included on the machine. So I just want to actually see you do what I'm doing here, look at the clock, you know, we'll simulate 30 seconds, and then, okay, well, let me get your cuff off. Okay, let's look at this machine again. While I was busy talking, it went to sleep. What can you do to wake it up? You just push that little mode button, and it comes right back up and gives you all of your values. Okay, one thing I didn't talk about, because I'm busy talking, is your pulse oximetry. So after you put your blood pressure cuff on, you can go over here on the opposite hand. I usually use your index finger with the light on the bottom of the finger, like that. This will count your pulse, and it also will check your oxygenation level. So it takes a minute to assess. You want this number to be greater than 90. Most everybody that's normal and healthy, their value is going to be 96, 97, 98, 99. I've never seen a 100 unless the patient's on supplemental oxygen. So that's kind of where you want it to be. All right, and once you get that, take your little clip off. We've got all the vital signs we need. Now you need to make sure you take your clipboard in the room so you can write these things down. And always, always write the patient's name and then write their vital signs. I had a student one time, wrote down the patient's room numbers, did like 10 sets of vital signs, went and handed it to the nurse, and the nurse is looking at the room numbers, and she thought, we don't have a room number. I forgot what it was. But anyway, the student had transposed some numbers. And so now all those vital signs, we don't know which ones belong to which patient. So she had to go back and do all those vital signs again. So very, very important that you write down the patient's name and the vital signs underneath. Never identify your patient by a room number, okay? So we finished all of our procedure here. Now we need to do our post-procedure guidelines. So we're gonna move this out of the way, raise the side rail, lower the bed. Are you feeling okay?
I am.
Okay, do you know how to work the call bell?
I do.
All right, let me grab some hand gel. You let us know if you need anything, and
Okay.
somebody will be around to check on you shortly, okay?
Okay, thank you.
All right, so now you're gonna take this, plug it up where you found it, report any kind of abnormal vital signs to the person you're shadowing, or give them the values that you've gotten for all of your patients. Okay, so I think that's it. If you have any questions, just ask your teacher, send them an email, text message. We'll talk about it in class. So I will see you later.